For the transfemoral or above knee amputee, the dressing change and rigid removable dressing process differ. To begin the dressing change, a strip of Xeroform will be applied to the incision site similar to the transtibial amputee. Next, a Primapore strip will be applied to the width of the incision. Note that these may need to be cut or more than one may need to be used depending on the length and shape of the incision. No Curlex is used for the transfemoral dressing change, keeping in mind these steps may differ based on the physician or surgeon preferences. Once the dressing change is complete, the above-knee shrinker is applied. The size is chosen by the prosthetist based on the circumference of the patient's residual limb at the time of fitting. To apply, the four-handed method will need to be used. There is not a donning tube option for the above-knee amputee. To begin, the shrinker will be pulled horizontally by one person and vertically by another, or the patient, to allow the opening of the shrinker to be as wide as possible. From there, gently slide the shrinker on the limb, ensuring it is as high as possible, especially in the perineum area. The fabric in this region is thinner to accommodate for excess tissue, which should be contained as much as possible to avoid discomfort and issues during wear. Ensure there are no large wrinkles in the shrinker. Unlike the below-knee shrinker, the above-knee shrinker will be doubled up to sandwich the kiwi cap within it. The kiwi cap, made of the same foam as a transtibial rigid removable dressing, is custom made for the patient based on measurements taken by the prosthetist. Due to the custom nature of the cap, the patient may receive this a few days following the initial dressing change. To apply, the slits are placed medially and laterally on the patient's limb. The overlapping nature of the slits allow the cap to decrease in size once a leg begins to shrink. As the slits are placed medial and lateral, the excess shrinker is pulled through the distal hole once a plastic ring is pulled taut to the patient's distal residual limb. Once threaded, the shrinker application process will be repeated, but this time over the top of the kiwi cap, ensuring it lays flat and is not bunched proximally. Once the shrinker is in place, secure the waist belt portion of the shrinker around the patient's waist and secure it with the Velcro. This will help to prevent the shrinker from distally migrating off of the residual limb. Please note that this is a painful process for the patient more often than not due to the limb being very sensitive following surgery. If meds are due for patient, it is wise to distribute them prior to shrinker application.